You are watching the Doc Talk Show.
Hi everyone, my name is Atwine, the Permanent Secretary, Ministry of Health, and I'm glad that we are talking about sickle cell. Sickle cell is a big killer of under 5, and we see is one of those causes of morbidity in adults and children. The plan that we have for the Ministry of Health, first of all, is to increase the awareness to the public, because we know that many people actually don't know about this disease, and even those that are sick, some regard it as witchcraft, and you find that they do not seek the right medical attention, and that affects the care, the quality of care, and also the outcome. So one of the plans that we have is to increase the awareness to the public so that people know the importance of testing, of prevention. The sickle cell disease can be prevented if the people intending to marry carry out tests so that they know and they rule out any possibility of them having traits. Traits are silent genetic material that once combined from a man and a wife, you get children that have the sicklers, the real full-blown sicklers. So therefore, this can be prevented by testing before getting married, so that you know that you don't have those traits. Because for sure, that one is clear, it's science. If you have both of you, if you have traits, then you know that you have children who have sickle cell. But also those that are unfortunate and they have it and they got children who are sicklers, they also need to know how to take care of them, to ensure that they seek medical care, to avoid conditions that predispose them to the painful crisis, to avoid infections that would predispose them to, especially to loss of becoming anemic. So all those are things that need to be taught to the public. So we are continuously engaging the public for them to know. The second plan is to increase access to care. Now, increasing access to care means that we are ensuring that there are essential medicines available. I am glad now that we have hydroxyurea medicine available, and we are working with partners to ensure that this medicine is availed to the population out there that need it. The third one is to ensure that we train our health workers to raise that awareness even among our health workers, to be able to detect, even using the simple means, but to detect and suspect, first of all, to suspect the sickle cell, and also to carry out diagnosis, so that we do not lose any opportunity for the sicklers who need care, that they'll be missed. Of course, the challenge has been to budget for individual illness. Sickle cell is another chronic illness like diabetes, like hypertension, like rheumatoid arthritis, like any other chronic illness. Therefore, we have not allocated resources directly that this is for sickle cell, but we have allocated largely the budget for testing, for treatment, like any other illness. So there's no particular budget set apart for sickle cell. But also we want really to scale up the treatment centers where people can be treated. The regional referral hospitals, the general hospitals, the health center force. Also to raise awareness, even in the lower units, that they are able to have high index of suspicion, especially in the areas that have high prevalence of sickle cell, such that the simple method of treatment, like malaria, like if they have painful crisis, how do you manage? Because that one you may not have to need to refer. So that really the care is integrated, the services are integrated within our routine care. I know that we have some specialized clinics in Mulago, for example, and even we do some outreaches to test and to have special clinics for sickle cell. But we want this to be integrated in routine with other diseases, so that it's not just standalone, because we do not have those resources to treat one disease, on the side. The message I leave you, the public, is that sickle cell is not a witchcraft. Sickle cell is a genetic disease, but can be avoided. You can avoid having children with sickle cell if you seek counseling and testing, so that your partner, you and your partner know before you have children. Because when you have children together and you have the traits, then there you will not have prevented. But also, sickle cell is a very debilitating disease, and it has attributed to death of under 5. The biggest contributor of death of under 5 children is sickle cell. Yet, we can avoid it. The other thing I wanted to conclude with is that sickle cell, now because of the advanced technology, we are seeing now bone marrow transplant possible. But in Uganda, we haven't yet started doing the bone marrow transplant, but we are hopeful that by end of this year, if it was not for COVID anyway, we would be able to start to do bone marrow transplant. Unfortunately, the COVID came in, and we have taken over the facility that will be used to do this, to give this service. But we know that government is committed, and we hope that in due course, once we overcome this current crisis we're in, we are going to start seeing, now we have children and old people transfused, but mainly the children, because the outcome is better, to transfuse and to have cure for sickle cell. But for now, the only solution is to be aware of the factors that bring about those attacks, the painful crisis for the sicklers, to ensure that they eat well, to ensure that they avoid infectious conditions that put their lives at danger, and to ensure that they get the support of the family.
You are watching the Doc Talk Show.